All right, today we're going to be talking about the PureWick female external catheters. They are going to be stocked in both ER and acute, and they do have a picture graph on the front on how to do them. But basically, the important part is you need to have a suction canister and tubing. We'll get to setting up the appropriate milligrams of mercury that you want it at. Then you, of course, explain the procedure to the patient. Inside here there is a wipe off Pericare wipes. Open that up. There's 3 of them. You're going to go ahead and make sure their legs are spread, because this is important. I would put a white absorbent pad under them. Of course, you're wearing gloves. And you're going to clean this side, throw it out. Another one, this side, throw it out, down the middle. Then you're going to take the catheter. This is made out of non-latex rubber, so it can be used on people who are allergic to latex. It is not sterile, so obviously you just need regular normal gloves. And this rubber part keeps it from urine from leaking out down the bottom or out the back. And holding open the labia, you're going to put your device. You don't want to go over the anus, so just kind of like that, and then let everything close up naturally. Make sure you have it wide open to fit this in there, because that's kind of what holds it in. And then have them put their legs together, and that further holds it in. You do not put tape on there or anything else. You do not tape that in place. Then get your suction, hook it up, and you're going to set it at, you're going to set the suction on full suction. You don't want it intermittent, and you want it to be set at 40. So when you turn it down, you don't want to occlude it with your fingers, because you want it to be at 40. So there we go, set at 40. That is one of the most important parts of all this. Too high and you're going to cause labial damage and vaginal damage, and you don't really want to do that, because she doesn't want that either. Then the other important thing to remember is that if it's not seated correctly, then you're going to have leaks. Also, it has to be changed out every 8 to 12 hours. Then your urine is going to be absorbed from there into suction. You can't feel suction, which is what you kind of want. And then that's it. If the patient moves around a lot, it may come unlodged, in which case you're going to have urine leakage. But then again, the main key parts are have it well seated with, when you stick it in there. You can put a little bit of tape, like the blue tape we're using is the only tape I would use on here if you're going to do that, on this tubing, to keep it from getting tangled up and falling out, but that's it. Don't tape, you're just taping this tubing here one time if needed. That's the only tape. And there you have it. Any questions, come see me, and I'll have one of these to look at, and I'll answer any questions anybody has. Thank you.